Okay, so I can see already a few queries on the chat, right? But if you also, are here for the first time in the session with Dr. Chavi, I would love to know, how many sessions you've attended before this, or if this is your first session that you're attending. Let me know in the chat, right? Okay, 4 sessions, first session. Okay, so a lot of you are here for the first time. A lot of you are attending many, many times. That's really nice to see, right? Okay, great. So many people are here for the first time. So all the first timers, I just want to give all of you a very, very warm welcome. So this session, if you don't know, happens every single Tuesday at 7:30. So I'm really happy that you're here for the first time. I really hope all of you do continue joining us every single week, because in this session, we basically shed light on a lot of different topics regarding diabetes, regarding medications, anything, even about diet, lifestyle, fitness, everything, right? So we're going to be touching upon a lot of different topics, and each session will be very different from the other. But I think it would all very, very help you in your journey of diabetes reversal. If you're just looking to manage your diabetes, even just get better in when it comes to your health and fitness, that also we can really help you with if you sit and listen to the session very carefully. So I think you can really benefit from this. So do stay tuned. And towards the end of the session, we also have Dr. Chavi's 6 steps, which is a small presentation that we will be sharing with all of you. And it basically talks about 6 steps that you need to be doing on a day-to-day basis, especially if you are someone who wants to reverse your diabetes. So stay tuned and we'll get started with the session very soon.
I think we can start, Shiva.
Okay, great, ma'am. I will
We
just
have
get
about 280 people
Yes,
who joined, so I think it's wonderful.
yes. So yes, I just want to again thank you so much, ma'am, for joining in. Thank you all the participants as well. And I just want to wish all of you a very, very happy Ugadi, right? So thank you so much for joining us today. So before we go ahead and get started with the Q&A, I'll just quickly introduce Dr. Chavi, right? So Dr. Chavi, as most of you all know, is the Chief Medical Officer at SugarFit. She has more than 28 years of experience as a physician, and she's been treating patients with lifestyle diseases like diabetes, hypertension, high cholesterol, etc., right? So she's trained in the US, and also she used to practice in California as well. But currently, she's now in Bangalore. And as most of you also know, she really believes in a lot of lifestyle and fitness and habit formation, right? So she believes in using those things to reverse lifestyle diseases, to reduce all the complications to the heart, kidneys, and liver, all by a non-medical approach. And she also will be sharing her 6 steps of daily living today, which have been a very important cornerstone for SugarFit's approach in diabetes reversal as well. And as most of you know, this session in the Talks with Dr. Chavi, we will be answering all your queries, we'll clarify your doubts, and also show you a glimpse of the path back from diabetes. And this session happens every single week. And in case your questions don't get answered today, you can still really benefit from her expertise. And next time, questions, is there anything you
Yeah,
would like
just
to
going to
say?
highlight it, my screen. So I would really like to thank everyone for joining. It is a festival all over India, actually. So I would say, आपको चैत्र नवरात्रि की बहुत सारी well wishes, गुड़ी पड़वा की बहुत सारी good wishes, उगादी की बहुत सारी good wishes, हमारा नया संवत शुरू हुआ है उसकी नए नए साल की आप सबको शुभकामनाएं. And आपको Chiti Chand also is today. So I wish all of you, whichever festival you practice, lots of good wishes. I think it is year 2081 by the Hindu Samvat, and I think it is a very big day and in our Samvat New Year. So wishing you all a very happy, healthy, wonderful New Year. So I think, Shiva, we can start with the questions. And, everybody has joined on a festival, which is, I thought today will be a day where very few people will join. So I am very, very happy that they have taken out time on a festival to join our India talk. So let's go ahead and as many questions as we can accommodate.
Sure, ma'am. So one of the first questions is by Miss Sandra. So she's asking, is there any way to find out how one gets type 2 diabetes?
Type 2 diabetes is already known, Sandra. It's 90% of the time happens because of insulin resistance. Our bodies become resistant to our own insulin. And if you want to check your insulin level, you can do a fasting insulin level or a HOMA IR, which is also a blood test. And it tells you how sensitive your body is to the insulin you're making or how resistant is your body to insulin you're making. There is not much of the other reasons that cause type 2 diabetes. And I think insulin resistance is known as the only way which leads to type 2 diabetes. So check your fasting insulin, check HOMA IR for insulin sensitivity.
Thank you, ma'am. Next question. This is by Mr. Manohar. So he's asking, please advise if the prescribed medicines um, before meal can be taken after meal and vice versa on some days.
So let us not change that. There are various medicines in diabetes that can be taken, that have to be taken either before a meal or after a meal. I can tell you just a little a reflection. I'm not advising, your doctor is your final call, but medicines of the group, which is glimepiride, gliclazide, glipizide, they have to be taken before food. Medicines of the group dapagliflozin, empagliflozin before food. Medicines of the group metformin after food. And now you will tell me there are combinations. So if metformin comes in a combination with glimepiride, gliclazide, it's before food. But if metformin comes alone, it is after food. Dapa before food. Dapagliflozin with metformin before food. So there are so many different combinations. It's not fair to ask advice, but whatever has been suggested to you, do not change it. But suppose if you were to take the glimepiride, but metformin was supposed to be taken before food, you forgot. Don't worry, take it after food. At least it will work 60%. If you don't take, the sugar levels will go very high. So if you by any chance miss your before meal medication, safely take it after meal.
Thank you so much, ma'am. So moving on to the next question. This is not sure who this is, but the question is that they have sciatica and their doctor has advised them not to walk. So in that case, they're asking, how do I cope with, diabetes management? Because, they have been advised to walk, after a meal and regularly. So in this case, what can they do, ma'am?
Very good question, ma'am. One of my favorite questions. And it helps me explore the various ways you can make your muscle mass, you can make your exercise be very good for your diabetes management. So the question that is asked is that they have sciatica, they cannot walk. So how can they manage their diabetes? How to carry on the adherence to interventions provided, which means walking after meals and so on. I do agree that that becomes a problem. But remember, your body just does not have only lower limbs, right? The body has upper limbs. The body has various parts of your body which you can exercise happily. So even if you have sciatica and you're lying in bed, in the air you can do cycling. Up to the count of 20, stop. Up to the count of 20, stop. You have therabands, which you are sitting on a chair or standing, which sciatica standing is possible, but if you cannot, depending, you can do lots of pull-ups of isometric resistant band exercises from your hands and even the other leg where the sciatica is not there. It is very important for all of you to understand that just because you have pain in a region doesn't mean that the rest of the body cannot exercise. Also, a very important thing that I want all of you to understand is that alone walking is not exercise. You have to understand that walking alone is not exercise. TheraBand, 1 or 2 kg weights, cycling in the air, doing a few abs, all of that is possible with the sciatica, with a limb problem. आप believe नहीं करेंगी जिनको भी sciatica and whoever has put the problem. There are patients who have paralysis and they are exercising. They are making muscle mass. So I think making our mind understand that there are many, many ways, and it's not just your mind. We have live classes, we have various different videos in our app which you can follow. It has to be an attitude, it has to be a mind, it has to be a way. And I do agree that you might not be for some time able to adhere to the walking part of it, but NO dump is done with hands. NO dump is an exercise after meal that helps reduce. Soleus push-ups is a sitting exercise that does not have any role in sciatica or lower back pain. So there are multiple ways by which a person can get blood circulation, exercise. Walking alone is not exercise, and you can very well control your sugars with all these different exercises I've told you, rather than just thinking about that I cannot walk with sciatica.
Thank you, ma'am. So, ma'am, another very similar question related to exercise, right? So they're saying that they have a lot of muscle loss. So are there any specific exercises that can help with muscle gain and anything with diet that they need to follow?
Both diet and exercise. So muscle mass loss actually was never there. So anybody who loses weight thinks that they have lost muscle mass, but the reality was that it was fat. It was not mass. But because it looks stretched, because there is so much fat under the skin, we think it is muscle mass. But sadly, that fat had to be lost, because without losing that, fatty liver will not go down. So whenever we lose that, we start assuming that, and the skin becomes loose, we start assuming that we have muscle loss. I'm very sorry, there was no muscle. What kind of exercise had you done that you had a lot of muscle? What kind of food were you eating that you had a lot of muscle? You have to ask those questions. Muscle doesn't come from the air. If you were a bodybuilder, if you were having strong biceps and no fat, and then you have pneumonia or you fall sick, when you get out of bed, you see that your muscles have gone. That's muscle loss. When you lose weight in diabetes, you lose fat. There is not much of muscle there to lose. But saying that, if you are in a lifestyle program, what you learn is how to now fill this place which has been left by the fat by muscle. And that requires work. That requires isometric resistant band exercises. That requires small amount of weight lifting. That requires movement of that organ. And it also requires a good amount of protein. Every day. All of that is a calculation you do with your nutritionist or your life coach. And you take the protein, but if you don't exercise, it is no good. So you need to take protein and you make sure that the protein reaches that part where muscle building starts. I think it is a process, it is an understanding, and definitely you will build up muscle. But remember, the diabetics who lose weight don't lose muscle. There was no muscle. We had not done any gymming or exercise or high protein. We have lost the fat that we had collected over time, which makes us feel that the skin is lax and we might have lost muscle, but it's not muscle. Now you will build muscle with coaching or understanding of your diet or exercise, and you will definitely slow. Now it is a very slow process, so and we don't need miracles in 1 month, 3 months, but it is a lifelong process. So remember that you have to. Now, I have to also say one more thing very important here, Shifa, is that if I go on vacation and I build my muscles every single day of my life, it's my habit. So you must be thinking that if I don't do it for 2 weeks, I go somewhere, I should be fine because I've done it for 20 years. Wrong. If I go for a 2-week vacation, Shifa, and I come back, I can actually see my muscle loss. Just 2 weeks. And then, of course, if I pick it up, it happens very fast because my diet, my exercise, everything is controlled. And I've done it for 20 plus years. So, of course, my body is much more ready to make muscle because it's trained now to make muscle. But even in 2 weeks, if I don't exercise, I lose muscle. Next question.
Yeah, thank you so much, ma'am. So moving on to the next question, ma'am. So this is they're saying that I'm 36 years old and I'm following all the recommendations provided in terms of diet and lifestyle. However, their HbA1c still remains high. And when they did their C-peptide as per your suggestion, they found that the fasting C-peptide is 1.04 and postprandial is 4.53. So they're asking, what does this indicate?
So I'll repeat the question for everybody to understand. This is very quite interesting, quite integrate, and everybody. So, young woman, 34-year-old, has had diabetes for a long time. Perfectly normal BMI. Exercises daily. Extremely good in her diet. Is tired because the A1C keeps climbing. And gets to see me and says, what do I do? What is this? Because I am doing everything right. I don't know what else to do. Nothing is working. And yes, the coach is also working very hard. So I look at that and I say, it's been a long time. You were in your 20s when you had your diabetes, or maybe she was in early 30s when she had diabetes. You never know that this could be something else. So a C-peptide was ordered. A C-peptide is a test for everybody who's new. It is a test to check if the cells that make insulin in your pancreas, called the beta cells, are they making insulin or not? And this separates type 1 or type 1.5 from type 2. In type 2, we have extra insulin that's not working in our blood. But in type 1 and 1.5, there is a deficiency of insulin because the cells in the pancreas are not making insulin. So when we did a test on this young lady, the C-peptide fasting was 1.04. According to me, 80% of your beta cells do not work if your C-peptide is 1.04. So definitely there is an insulin deficiency here. Fasting insulin was not done, but C-peptide was done. Now, the surprising part in this case is very, very significant, and I want everybody to hear that, is that the post-meal, when she ate food, the C-peptide rose from 1 to 4.5. Now, that's a lot of pancreatic function. There's a lot of response to food is great. So what is this? So that's why they say in medical science, not everything fits the bill. But on my understanding and discussion with other senior doctors, this case seems like a type 1.5 or an autoimmune kind of a injury in adulthood to the beta cells. And that is why the fasting C-peptide is quite low. But because up till the age of late 20s or 30s, the patient was able to make insulin. The response to food is still there and might be there for some time. But can easily wear off. So in this situation, a doctor should then check for autoimmune injury to pancreas. And for that, there are some antibodies. The name is islet cell antibody. There is a glutaminase GADA antibody. There are many. There are 4 or 5, but these are the 2 we check and see if there is an autoimmune antibody present. And I think that is, but a very important part of this case, Shifa, was also that there was a crazy triglyceride level. Everybody is familiar with triglyceride. Triglyceride is what? It is a saturated fat. It's a tri, 3. Glyceride is glyceride, glucose, which has become fatty. So it is triglyceride coming from carb. It's a free fatty acid that goes to your liver and gives you fatty liver. A young lady who does not eat, who exercises every day, her triglyceride was 481. Now, this is interesting because a lot of times, whatever she's eating is getting converted into triglycerides. She's not eating much. She's really exercising. So there is a genetic, for sure, defect in the carb metabolism, which is the reason why that much free fatty acid is being formed in our body. Sometimes this free fatty acid, because so much triglyceride is being formed, it goes and sits between your liver cells and your pancreas and does not let them work. And if that is the case, the primary issue here becomes, maybe it's not even autoimmune type 1.5, but it could be hypertriglyceridemia related to not letting the metabolic function of liver and pancreas happen. So what do you do in this case? You lower the triglyceride. You give the medication so her triglycerides come back to normal in the next 3 months, and then you see her response to glycemia. Then you repeat the C-peptide fasting and see if there was a response. So instead of declaring that this patient is an autoimmune type 1.5, you first lower the triglycerides. You might order the antibody, that would not hurt, but it's very important to bring the triglycerides down to 150 ASAP. And this is really very important to understand that if there is too much triglycerides being formed in our blood, it's like a fatty molecule that will go and sit between your liver cells, will not let the liver work. Will go and sit between your pancreatic cells, will not let them work. So if that is the case, and if that is the root cause, can we fix this by lowering the triglyceride? Is my action for this young lady. And I'm hoping, and I will give you guys a feedback in 3 months. And this is very interesting. And I like to bring this out. And I'd ask Shifa that I'm sure she would not mind. And I'm sure she's here on the platform. It's very important that every single person learns from all of us. And if we learn and if we understand, tomorrow we can say, yeah, my triglycerides is 500. That needs to come down. Dr. Chhavi said that will cause fat to collect between my pancreatic cells. So it's very important that when we look at a lab work, we just don't look at sugars. We have to look at everything and make sure that we know the right thing to do. So I'm having hope. I'm hoping that if I lower the triglycerides on our lady here, I'm hoping that tomorrow her sugar metabolisms will improve.
Yeah, it's awesome.
That's okay.
Yes, thank you so much for the answer. I think it really will help a lot of people who are, in the same boat. But moving on to the next question, ma'am, we did have a lot of questions about people who are asking about fatty liver, right? Like, how can we reduce fatty liver, and how, like, is there any connection with diabetes and fatty liver?
Absolutely, there is, and it's again a very important topic where I'm concerned, and I do believe that triglycerides, which are coming out of a sugar molecule, becoming a fatty molecule. So extra sugar in our body or extra carb in our body gets converted into triglyceride or the free fatty acid, which goes and sits in your liver and causes something called NASH. You all might are familiar with it, but I can tell you the full form. It is called non-alcoholic, means it's not from alcohol. Steatohepatitis means, steato means fat, hepatitis means inflammation in the liver from that fat. And this is becoming an epidemic, and it is growing year after year. And we are seeing literally in all health checks, especially in the Indian subcontinent, grade 1 or grade 2. Now, if you're grade 1, the most important thing is remember that whenever there's going to be fat in the liver cells, the metabolism will get affected. The glycogen metabolism, the breakdown of sugar metabolism, all of that, the storage of sugar as glycogen in the liver. So liver absorbs sugar from your blood and converts it into glycogen, and that's stored for some time when we need more energy in our body. When that metabolism gets affected, that does not get converted there, and that sugar stays in your blood and the blood sugar goes up. So liver is a very big organ that converts your blood sugars into glycogen, which is very important for later energy needs. So when there is fatty liver, yes, it will not let that happen, and diabetes either will show up or diabetes is already present, and it has a deep correlation between NASH and diabetes. The way NASH has been treated, non-alcoholic steatohepatitis or fatty liver in general, is for grade 1, we really work on you by, I give people a bioactive form of vitamin E, and I don't give it to you until you're my patient because your doctor needs to give it to you, but you can ask them a bioactive form of vitamin E, but it does not cure. It only helps release a bit of the fat out of the liver. But what really helps is lifestyle. What really helps is exercises. What really helps is weight loss. What really helps is to make the blood sugar levels in your blood low by eating low carb diet. So there are many, many, many ways of lifestyle, just like diabetes, that NASH will improve. So yes, non-alcoholic steatohepatitis or fatty liver. Now I want to bring to your attention is that if you have grade 2, if you have grade 2 fatty liver, I want you all to do a test, if possible, called fibroscan. Fibroscan is like a CT of the liver, which actually tells us if there is hardness in the liver. What does that mean? Fibrosis in the liver. What does that mean? That when there is fat between the liver cells and it is grade 2, and if this gets converted into a harder tissue or fibrosis, it can turn into a huge complication of the liver. So whenever somebody comes to me with grade 2 or higher, ultrasound, I immediately send them for a test called fibroscan, because now I need to know your GPA score. I need to really know where this is. Is there any fibrosis or it's just fatty liver and I can work on it in lifestyle? Remember, any fibrosis that has happened in the liver is non-reversible. Fatty liver, reversible. Fibrosis, non-reversible. So it is very important for a doctor to assess which level my patient is and what do I need to do about it. Next question, Shifa.
Thank you, ma'am. Oh, yes. So moving on to the next question, ma'am. So a lot of people, were asking also about your blood sugar spikes in the morning and also after like exercise. So many people are having issues with high fasting sugar levels, and they're asking why is it increasing? And a few people are facing high sugars after a workout. So in that case, are there any things which they can do to help this?
So number one, this question gets asked every single India talks. I have not had an India talks that this question has not been asked, right? So I think first and foremost, I just want you to understand that whatever sugar you are checking, fasting, postprandial, and whatever sugar you're checking, random, it only reflects maybe 50% from the meal that you had previous to that check. And 50%, it also is an effect of the meals in the past with no exercise. So suppose if you ate a food and your sugar reached 250, only a part of that came from that lunch food, but a lot of that came from part of it came from your breakfast. A part of that 250 also came from the dinner previously. So please stop looking at numbers at a point level. Look at your life. How many meals prior to that have we not watched ourselves? How much exercise did we not do in the last 2 days? And please don't try to fix sugars overnight. You might try, and let me put it another way. I'm sorry. You can try to fix sugars overnight, but if the result doesn't come, you need to know that your body is not a machine. It is God made. It has its own mind, its own metabolism. So for you, if it's taking 48 hours, be patient. Just keep doing the right things. Now, question was asked, my fasting stays high. So what I want you to do, I want you to, before bedtime, check your sugars and see what your sugar levels are. Now, let's assume that those sugar levels at bedtime were very good. Then why fasting is high? That's a good question. So in those cases, there is sometimes that the patient has a habit or 3 a.m. to 4 a.m., which is our circadian rhythm cycle, our sugar levels fall. Because at that time, our cortisol level are the lowest. So at that time, I tell people to wake up for 3 nights and make sure at 4 a.m., 3:34, they check their sugars. Now let's assume, and if those sugars are low, the liver just pumps the glycogen as sugars in the system, and your fastings become extremely high. So it's very important for people not to have low sugars through the night, because if they have, then the fasting, because the liver senses it, it pumps. So this is a good exercise. Next 3 nights, check your sugars and see if there's low. Then we need to fix what you need to have at bedtime, and a coach can help you. And then if the 4 a.m. sugars become stable, you will not become fasting. Now, if suppose your 4 a.m. sugars come down, still fasting is high, and not one time, not two times, not three times. So your going to bed sugar was normal, your 3 to 4 a.m. sugar was normal. What is the reason that my fasting is high? Again, a good question. And that has been put um, as something called dawn phenomenon or Somogi's effect. In this condition, the hormones in the morning in our system are actually a little bit disturbed. Let's say. So when we wake up from lying to sleep, the our hormones sort of get a little disturbed. And as a result of it, the cortisol or the stress hormone is high. And you do whatever you want to do, the fasting doesn't get less than 120. In such patients, I really want them to leave the desperation, but to check throughout the day. And if their post meal is less than 130 or 140, if their pre-lunch, pre-dinner is less than 110, please leave yourself alone, because you're fine, your A1C will be normal, and it's a body, it is not a machine. So there is somewhere something in the cortisol hormone effect in the morning, which is causing a little surge without eating also. Another question that was asked today was, if I exercise, after exercise, my sugar, it's very similar to what I taught you with the neoglucogenesis, which 3 to 4 a.m. sugars are low. So when you exercise, your liver senses low sugars. And as a result of it, it pumps the glycogen in the blood. And after exercise, there is a spike. But in these cases, mostly I see that the patient says right after exercise, there's a spike, but 1 hour later, my sugars are beautiful. So that spike was the pumping of glycogen by the liver into your blood, because the liver sensed that the sugars were low. But as soon as the glycogen brought the sugar level, the liver stopped pushing the glycogen. And there was a beautiful stable state where your muscle was soaking up the sugar from the blood, because you have made muscles in exercise, and you get to a fabulous level about an hour after that. So the way we work with that is that we make sure you don't go to your workout empty stomach. You don't take um, uh, without any meals. Going for exercise may cause that. So we like you to have some healthy nuts and half an apple before you work out. And that really sometimes does help. Drink a lot of water.
Thank you so much, ma'am. So, moving on to the next question. So, there were a lot of questions on how we can improve the good cholesterol and how we can reduce LDL levels in the blood. So, do you have any suggestions for this, ma'am?
Yes, very much. Again, another very, very favorite question, which is very relevant to the Indian subcontinent, to our country. So over the years, as we have evolved as a civilization, India, I see a lot of people, youngsters, a very low good cholesterol. So I'll just like to explain. I know you guys have heard it a million times, but I always like to start for people who are new to understand cholesterol very deeply. And why do we divide it as bad, good? Just because by saying bad, good doesn't something become good. So all of you need to understand every single thing deeply. So low density lipoprotein. Low matlab less density of the fatty particle lipoprotein, LDL, bad cholesterol. So when if some chemistry individuals are here who will understand what I'm talking about, anything which is less dense, suppose a particle which is flowing in a fluid, less dense will stick walls where it's flowing, stick. So LDL is low density. It sticks to the walls, right? And that causes clots. high density, good cholesterol. The higher the density, the less you stick and the more you float and leave. So you will not cause an obstruction. So we want more and more of your cholesterol to get divided into the particles that are highly dense than the VLDL or the LDL. So it's very important for everybody to understand why we say LDL is not good for you, because it will end up sticking to the walls. Now, what do we do for that? So I always tell people that you try daily exercise for an hour, something, whatever your body allows. Therabands, weights, cycling in the air, going for a bike ride, swimming, tennis, walks, and that itself is going to raise your HDL. Now we have such poor genes that people do that and they'll come back and tell me, ma'am, 5 points only HDL has gone up. And I know that. Now that is the case where I don't want to take a chance with their heart. So I will give you some medication because you've tried. There are certain foods also which are known to increase the good cholesterol. So for example, things that are rich in omega-3, omega-6, and out of that, nuts are good, seeds are good, and I tell flax seeds and chia seeds. But I also tell fish. If people eat fish, river fish is okay. Tuna, salmon, these are kinds of fishes that have very good omega-3 and will help you raise HDL. And now there are coming omega-3, omega-6 supplements, which are also very good in raising good cholesterol in your body. But the other question is LDL. And how do you reduce LDL? Low density, which is our enemy. We don't want. And lowering LDL is always watching fat, always watching fried foods, always watching anything which butter and ghee and milk and anything which has any component of fat is going to create LDL. So yes, that is what you need to watch, and make sure some kind of aerobic exercise, which would be cycling, swimming, skipping, running, brisk walking, and consistently every day. You cannot say I did 3 times a week or twice a week, consistently every day. And I promise you will change the entire chapter of your cholesterol. I know the HDL still will be an issue. We'll give you omega-3 on the sides. That's an Indian thing. But if you do that now, and if youngsters do that now, you will again cause a shift in our evolution of our civilization, of the heart disease in our country, of the youngsters with such heart disease. We will. And now I'm not being controversial here. Please, everybody has to, people will start saying, हमको घी अच्छा बताया है किसी ने, हमें बटर अच्छा बताया, किसी ने हमें बोला है कि आप घी खाइए. I'm very sorry. I'm not controversial. But what is not right, if I see your LDL high and your HDL low, I will not want you to take ghee. Not because I have anything against ghee. I have ghee. My LDL is good. I don't have dry rotis just because to torture somebody, you have to have dry rotis. There is a reason. Why don't you exercise for a year? Why don't you really listen to omega-3, take omega-3, omega-6s, foods rich in omega, fix your LDL. फिर आप लीजिए ना थोड़ा घी के अंदर खराबी नहीं है, हमारा LDL बढ़ गया है, and that is why cheese and ghee and milk has been asked to be stopped. Please, we have to learn as a country not to controversially put other things down that we have been told not to do this and this is good for us. Get your LDL down by your lifestyle. Do something about it. Do aerobic exercise. Do something consistently every day. And when that LDL gets close to normal, nobody will stop for you to take a reasonable amount of something. Not crazily, but reasonable amount. Because these foods were part of our diet. They were not bad. But our ancestors used to work in the fields. They did not have trains. They did not have cars. They did not have planes. They walked, they cycled, they worked in the fields. Yes, they could have ghee. There's nothing wrong with ghee. But they earned that ghee. So all of you go ahead and earn that ghee. There's nothing wrong. do the lifestyle that you can bring the LDL down. And then, so there is nothing, I'm not sitting here trying to make some food look bad. Please, you have to understand. I'm only concerned about having a high LDL and then still consuming that food that will bring LDL. Shifa, next question.
Yeah. Thank you so much, ma'am. Suman, there were a couple of people who they are already in the program and but they're not able to see any, improvements. So what would your suggestion be for them?
So I can tell you very much that first and foremost, you need to have a discussion with your doctor that do I need blood test or C-peptide or fasting insulin to check my pancreas or my insulin resistance and where I am. So knowing exactly where you are and knowing your function of your pancreas is very important. So first and foremost, and then each of you need to look into how much and how much percentage of interventions. It could be diet, it could be sleep, it could be exercise. How much of those habits that I talk about, the 6 habits, have you adapted? And I'm going to go at the end of this discussion and you can look at those habits. So if you have not adapted those habits, then the whole purpose of the program has not sunk into you and you might not see change. A change. So I'm not saying that the pancreas is working very well, or I'm not saying that that has to be checked for sure if there is a reason there. But remember that most of the time, and I'm generalizing, but 75% of the patients, so at least 7 to 8 out of 10 patients, there is a lag in following interventions. There is a lag in following the circadian rhythm. There's a lag in following the sleep and exercise. And there is no magic wand. There is no magic wand. I will still repeat that the reason, the way I have designed this entire thing is for you to slowly come into rhythm with the circadian rhythm of our earth, to come into the day and night patterns, to understand that life is not very difficult, but has to be lived with this discipline, and you can change everything. But if you have not adapted those habits, then there is no way there will be a progress in a program. So talk to your doctor, make sure your pancreas is working well, make sure your fasting insulin levels are down, make sure you're talking to your coach regularly and developing all those 6 habits that you see on India Talks every single day of your life.
Thank you so much, ma'am. So moving on to the next question. So this is by Mr. Rajesh. So he's asking, is there any link with uric acid and inflammation for diabetes?
Uric acid is a very important marker and of metabolic injury in the body. So uric acid is very highly associated with metabolic issues. So we consider it as a very important marker and we see why. And I would like to repeat to everybody, I'm sure everybody who has joined understands what uric acid is. And I'm telling you, the first thing people come to my office when they say uric acid, वो ना, there was some pain here, pain there, थोड़ा सा घुटने में दर्द था in my knee, and doctor, uric acid is high. I'm sorry, uric acid did not cause that. So I tell people first and foremost, that is not why you have the pain. And even if you normalize your uric acid, very less chance that the knee pains and the hand pains will. Most commonly, gout, which is an arthritis that can happen because of uric acid, which is made out of very sharp crystals. It settles into your joint, those uric acid crystals, and it usually should start from the toe, the big toe in your foot, not hands, not knee, and ankle sometimes, but knee, I have to. So uric acid, I don't think can give people those kinds of pains, but uric acid for me as a diabetologist is a reflection of poor metabolism in the liver. So when we eat protein, which in India anyway is very little. So nobody is having 1 gram per kilogram. We're all having 0.4 to 0.7. A good one is 0.7, which is not enough for muscle building in our body. But anyway, this protein is not then absorbed into our blood with as amino acids. These amino acids in the blood travel to your liver. And in the liver, they're supposed to go through 2 ways. One way is forming new muscle for you or creating new cells improving your immune system, improving your various functions of the body. That's a great use of protein, right? Amino acid. But then there is a second pattern, which is amino acid becoming uric acid. Now, what happens? Why does, when our protein is so little anyway, why is it all not going to healthy muscle or cell? Why is it going to become uric acid? It's because we have free fatty acid, which is fatty liver in the ultrasound. When we look at the fatty liver in the ultrasound, this free fatty acid converts your healthy amino acid into uric acid, and you have excess uric acid. So when there is excess fat, abdominal obesity, there is a higher chance of the liver not using the protein into a good metabolic muscle or bone or cells or immune system. It is going to convert it into uric acid. So the treatment is not having even less protein. Dal bhi chhod diya, paneer bhi chhod diya, hum to kuch nahi khate, uric. Then what will happen? That initial protein, which was anyway low, will become further low. So poor thing, whatever was going, anything to the muscle will stop going. What will happen? You'll become very weak. So the problem is not your protein. The problem is your blood sugar. The problem is your carb. The problem is all of that is converting into free fatty acid and causing higher uric acid production. So uric acid itself is not an inflammatory marker, sorry. But if uric acid causes gout, it causes massive inflammation in the body, arthritis, and then it is associated with a high CRP. But always remember that uric acid can be also high because the kidney is not clearing the uric acid. So we are not drinking enough water. There is uric acid that stays behind in the body and levels go high up in the body. That is through the renal or the kidney system where the uric acid is high. And all uric acid that's really very high can go and sit in your big toe and ankle, like these fine needles, and cause pain and inflammation. Now, that was the inflammation that I'm sure this gentleman, our sir who has asked this question, meant that. But for me, the inflammation also comes from diabetes. Inflammation comes from fatty liver. Inflammation comes from blood pressure. Inflammation comes from any lifestyle disorder that does not let our cells function properly because of free radicals from chronic lifestyle disorders, and metabolism gets affected. And those also cause your high levels of CRP that you get worried about. Obesity, plain obesity with fatty liver. No other disease happening yet. Later it will causes a high CRP. So you have to understand that that inflammation is a factor of many things. Arthritis causes inflammation. Viral infection causes inflammation. COVID, you'd seen the CRP going up. Cancers cause, high CRP. So there are many reasons TB causes any infection, typhoid. But remember that inflammation is another whole syndrome where our cells have too many free radicals. And anywhere from infection to diabetes, there are many conditions which causes inflammation. Now, they have also found out that inflammation is one of the biggest cause of cardiac disease, sudden heart attacks, obstruction in the heart, swelling in the arteries of the heart. So inflammation has become a very, very important word for all of us. And living a disciplined, sattvic life with beautiful thoughts. Thoughts are very important. The mind actually is one of the most important part of it. And once you start living pure, honest, positive, acceptance, and discipline day to day, no inflammation will come close to you. Your immune system will get better. Your metabolism will improve. So it is not just physical body. I explained the role of the brain and the mind and its positivity at a very deep, maybe one day I will just take India talks on how the mind and the thought causes us to lead to much worse inflammation and lifestyle disorders in our so the mind has to be also addressed along with physical body. Go ahead, Shifa.
Thank you so much, ma'am. So, ma'am, I think we'll just take one last question before we move on to the 6 steps. So, one of the question was that are there any supplements that we need to be taking if we have diabetes, and is there any relation with low vitamin D levels and diabetes?
Vitamin D as a vitamin is very important for the function of energy exchange in every single cell of your body. Mitochondria is a part of your each cell, which actually is the ATP or the energy warehouse of our each cell. If you have vitamin D deficiency, it affects everything. It could be skin, it could be hair, it could be asthma, it could be cardiac, it could be diabetes, but it does not cause it, but it worsens it. So vitamin D, yes, is very important. So I'll just tell you what I give to every single patient of mine. I give them a multi-B. I make sure levels are low. So a multi-B complex I give to every single diabetic for neuropathy prevention. It's very good for many other reasons. I give everybody a vitamin D once a month, provided the levels are normal. If the levels are low, I'll give them a course which is faster, and then I'll make it once a month for life. I give people older than women older than 55 calcium every day. Men, I'm not into calcium. And I also believe in giving magnesium, which is the new calcium. And if you guys ever want to hear my YouTube videos on magnesium, which is very important, I tell people to take magnesium. Usually magnesium comes in 550, 650. You have to look in behind and find how much of that is a bioactive. So bioactive 300 milligrams of magnesium can be taken, and the form that you take it is glycinate or bisglycinate, and not calcium, magnesium oxide or citrate. You should take more of the bisglycinate or glycinate calcium. I also like to, depending on people's fatty liver, give some vitamin E to people for some time. So these are things that I usually like to give as supplements, Shifa, to people. Um,
Thank you so much, ma'am. I think that would be really helpful for a lot of people.
Shifa, I know there was an unrelated question, but I can't help but read it. And it was about somebody asking a question like, is there a test for cancer? And देखिए, आप अपना health checkup, do your health checkup. And then health checkup, make sure you do a abdominal ultrasound, you do a chest x-ray, you also do an echo, and you look at your hemogram, which is your hemoglobin and your white cell count, and look at your cell makeup, look at your CRP. पहले आप ये कराइए. This is really not a direct test, but and mammogram for women, pap smear for women. There are many for women, that's it. And for men, it is ultrasound, prostate, PSA, just the common cancers. And if you smoke, your x-ray should be done regularly. So these are the common things that we do on day-to-day basis. But nowadays, there are these health check centers which also do various blood tests for markers of pancreatic cancer, liver cancer, colon cancer, ovarian cancer, endometrial cancer. These are blood tests. Uh, According to the books, they are not diagnostic, but they were supposed to be used when a person is being treated for cancer. These are used to follow how much improvement has happened to you. But I'm seeing that a lot of agencies are actually checking, and some like ovarian and endometrial, I believe that the markers are more important. So these are blood tests, and I don't want to outline them here, but the first and foremost is do a complete health checkup and discuss with your doctor your various blood tests, ultrasounds, and
Thank you so much, ma'am. So I think we can move on to the next 6 steps now. I'll just quickly go ahead and share my screen.
So of course, as I said before, that if you have not adapted some of these or all of these steps, you really have not got the program or understood what the program is trying to do for you. A program is trying to tell you that these are essential habits that if you can develop into your day-to-day discipline, you definitely will work better and your sugar levels will improve. That is why I took that case of the young lady who is doing everything, and she checks her sugars regularly. But of course, it looks like we have something else with high triglycerides, which is causing her issue. So I think I'll start with the first step, which I always believe that if you're not going to check, your sugars will keep going up. because there is no human mind that can monitor the meals so well that they don't need to check, because you would not know every single day. Starting your day knowing what your sugar levels is very important for you to do the amount of exercise, eat the amount of salad, sleep on time, because your sugar levels checked every day are very big indicator of your progress. If suppose you are way overweight and the purpose is your obesity and weight loss, then the same thing applies for you, waist measurement and weight. And if you're not doing that regularly, then you are ignoring the purpose of your whole understanding where your weight loss is the most important part of it. Number two, having salads before your food. So remember, before your food, 15 minutes before your food, you need to have enough salad. And if you have enough salad, then the carbs that you eat don't get absorbed really fast and your spikes are much lower. And that's very important to understand, that eating a bowl of salad before meal is very, very important. The step 3 is 7 to 8 hours of uninterrupted sleep, which is also again very, very important, that people who sleep in the right times, which is 10 to 2 in the morning, which is when your hormones are most active to regenerate your body. And I think it's very, very important for you to understand that that is the most important thing by which you can control your hormones and your metabolism. In the evening after the sun is set, remember, and the next step is, of course, living with circadian rhythm. And this is where you start eating when the sun comes out and you stop eating when the sun goes down. Your hormones, again, after the sun goes down, the insulin does not work, and your body starts to make different hormones that are regenerating the body or renewing the body. And that is why in SugarFit, we tell people 12 hours eating and 12 hours of fasting. And it's very important to understand that don't put calories once you are done with your dinner. Do your walk, listen to music, sleep early. And that's going to give you new hormones, and you regenerate, your tissues regenerate, your energy becomes better, your immune system is better. I will get hoarse saying how important, whoever is not staying in the circadian rhythm should not expect their sugar levels to go back. It is very, very important to come back and live. The earth actually moves within 24 hours, where half of our planet is as lit daylight and half is nighttime. And with this movement of the sun also moves our hormones. And when we are facing daylight, certain hormones come out. When we are nighttime, the problem is we eat late. The problem is we snack late into the night. We keep disturbing those hormones that do not need food, but they want to regenerate the body. They stop working. And as a result of it, fatigue, weight gain, lack of sleep, insulin resistance all follows. So please remember, staying in circadian rhythm is very important. Step 5 is various kinds of aerobics, strength training, yoga exercises, walking each day. Remember, it's very, very important. And it is very important that every single person does this. And you can do whatever you want. You can do exercises, you can do yoga, you can do Pilates, you can do strength and conditioning, you can do weightlifting. And I would really recommend trying multiple ways of exercise and not a one particular way of exercise. And I would be, this will really help your body. And the last and the final is meditation, which is staying at least 15 minutes in silence, where you take the energy of the universe within you, just silent. There should be no effort. If there is an effort, that is going to be a problem. And it is very important that once you do your meditation, you will get the energy from the outside. And this energy will definitely help you become mindful of what exercise needs to be done, what SMBG, what salad before food, what is your anger or stress or whatever issue is there. It will help you a lot. And I really believe that you start with 10 minutes, but the maximum you do is 30 minutes, not more than 30 minutes at a time. If you want even more, and some people do, I tell them you can split it